Welcome to Arirang TV's special continuing coverage of COVID-19. I'm Min Son-hee. QR code visitor logs have now become mandatory here in Korea at all high-risk facilities, including clubs, bars and singing rooms, as part of efforts to contain the spread of the virus. We have more later on in our program, but first, as always, here are the headlines with our Kwon So-ah and Noara. Welcome.
Hello.
Hi. So let's begin with the domestic updates.
Yes, we have a similar rise in new cases as yesterday, remaining in the 30s, or rather a slight rise to 38 cases today. If we take a closer look at our figures, the total accumulation now stands at 11,541, and one fatality was reported. And meanwhile, 823 people are still in quarantine, and 10,446 people have fully recovered. If we take a look at how the situation developed over the week, the graph went up and then went down again, but maybe not as much as we want yet. We are still in the 30s and double digits, and the majority of these cases are local infections concentrated in the metropolitan area. If we take a closer look, we have 14 new cases in the capital Seoul, 8 in nearby Incheon, and 15 in Gyeonggi-do province, and that is 37 out of the total 38 cases, while 2 out of the 38 cases were categorized as imported cases.
Right, and those numbers are the reason why authorities are calling for more caution among members of the public here.
Right, and especially in the metropolitan region, because that region is densely populated, with officials warning of a new wave in infections if we let our guards down. Health Minister Bang Neung-woo at a government briefing this morning called on citizens to avoid person-to-person gatherings and, if absolutely necessary, to keep masks on and try not to eat together. He called on religious worshippers and workers at medical facilities or nursing homes to take added precautions. The government also requested people in the metropolitan area to postpone appointments and gatherings at least until next weekend, citing difficulties of contact tracing due to the recent back-to-back cluster infections stemming from multi-use facilities. Authorities also stressed how basic social distancing measures and the wearing of masks at large churches helped in preventing COVID-19 infections there, whereas more than 73% of people tested positive for the virus at a church in Incheon recently, where worshippers reportedly did not wear masks. And officials have especially been stressing calling for responsibility from the nation's people as we are about to have the third stage of reopening of schools beginning tomorrow, which Aram is going to talk about later in detail. And government officials also stressed that social distancing measures are not a choice, but a must.
Right. So what is the latest on the international front?
Well, let's begin with the overview of the situation around the globe today. A total of at least 6.3 million cases have been reported as of earlier this Tuesday, Korea time. Over 377,400 people lost their lives due to COVID-19, and 2.9 million people have recovered so far. While the U.S. remains the only country with more than 1 million cases, here shown in the darkest red, Brazil has 500,000 now, and a dozen countries have more than 100,000 cases, with Chile being the latest country that surpassed that milestone. And for a detailed look at places severely affected, let's take a look at the death toll here. More than 106,000, almost 107,000 deaths in the U.S., and Russia has quite a low death rate compared to the infections, with more than 4,800. The UK and Italy have both more than 33,000 deaths. And India is now approaching 200,000 total infections with more than 5,600 deaths. And Turkey and Iran have 164,000 and 154,000 cases, respectively.
Meanwhile, now, I would assume that countries choosing to ease their lockdowns would be those that are seeing a drop in daily number of infections, but this is not the case.
Right. One country where the outbreak is actually still worsening, which is Brazil, is actually even relaxing restrictions already. Rio de Janeiro, for instance, on Monday announced it will open businesses and activities in 6 phases beginning Tuesday, with its mayor predicting the city to, quote, return to normal by August. that indicates guidelines on wearing masks and refraining from crowded places is followed. Churches, car dealerships, and furniture stores, as well as beaches, will be among the first to reopen. Brazil, meanwhile, is said to have yet to reach its peak in coronavirus cases, as well as many other Latin American countries. Peru, which has the second highest number of infections following Brazil, reported an increase of more than 5,560 new infections on Monday. And Iran, which was one of the early affected countries in the world and the worst hit in the Middle East. Here we are seeing Iran may be facing a secondary wave of the coronavirus if people ignore social distancing guidances. The country's health minister made that remark on Monday local time as cases are rising again following a gradual easing of restrictions since April. On Saturday, government employees returned to work and mosques began to open too. And those are the global updates.
All right, Sua, thank you for that. We'll see you again tomorrow.
Thank you.
Aram, the leaders of Korea and the US held phone talks about the G7 summit slated for late this year.
That's right. It was actually the third phone call between the two leaders this year. President Moon Jae-in accepted President Donald Trump's invitation to the summit. Now, Trump has said he was postponing the summit until September. It was originally scheduled for late June. Obviously, because of the pandemic, it's been pushed back. He said he wanted to invite South Korea, Australia, Russia and India, adding that the G7 was an old system now that did not reflect the current international situation. Moon told Trump he would welcome the inclusion of other countries and said it would be a sign of progress in the face of the global coronavirus crisis. Moon also reaffirmed Seoul's commitment to playing a global role in the fields of quarantine as well as the economy. The South Korean president also agreed that the current G7 system is limited in responding to international problems and finding solutions for them. And the two leaders, being the South Korea and the US being allies, also discussed a range of economic and national security issues as well.
Right. Meanwhile, a plea from the WHO to the US for continued partnership.
That's right. There has been some very tense relations between the US and the WHO, and President Trump actually threatened last Friday to cut ties with the WHO, accusing it of becoming a puppet of China during the coronavirus, as well as other blames and accusations. This was the WHO chief's response on Monday.
The US government's and its people's contribution and generosity towards global health over many decades has been immense, and it has made a great difference in public health all around the world. It is WHO's wish for this collaboration to continue.
Now, as I mentioned, tensions between the US and the WHO have been going on for some time now, and Trump has previously threatened to cut funding to the body as well. And he also sent a letter to the WHO on May 18th demanding it to reform within 30 days. Gov'T revealed that his organization has yet to receive any formal notice from the US regarding any threats made by Trump.
Right. Meanwhile, back here in Korea, as Soa mentioned, we have phase 3 of the resumption of offline classes happening tomorrow, Aram.
That's right. As you said, it is the third phase in the resumption of in-person classes. High school freshmen, middle school sophomores and third and fourth year elementary school students are set to return to school tomorrow. That adds up to about 1.8 million pupils. Once they go back, that would be more than 2/3 of Korea's entire school student population going back to in-person classes. Parents are still worried, however, especially amid the recent surge in COVID-19 cases. But the government is working to alleviate those concerns. Officials have been inspecting the safety conditions of private education institutes in the capital area where many students go after school. Elementary and middle schools are required to cap the number of children present at one time at 1/3 of the total student body, and high schools at 2/3. The number of students per classroom is also being capped to no more than 30. Now, strict quarantine and disinfection measures, of course, are also being implemented. Now, outside of the school grounds, the government is strongly urging businesses that teenagers frequently visit to remain closed at least until June 14th.
Okay, Aram, thank you for that. We'll see you again tomorrow. We move now to the US in this next corner, where authorities are seeking to control COVID cases and race riots, with the latter taking the country by storm as many react to the death of George Floyd, an African-American, while under police custody. I have Young Kim live on the line with more on the situation there. Hello, Young.
Good afternoon, Sunny. Thank you for having me.
Right, Young, thank you for being here. Please tell us more about the unfortunate death of this man and the nationwide demonstrations in response to his passing.
Yes, George Floyd. Now, he is the main figure behind this entire series of protests occurring in major cities across the U.S. Now, it's been 7 days since his death, which there was a video surfaced of the now former Minneapolis police officer, Derek Chauvin, that was kneeling on Floyd's neck for 8 minutes and 40 seconds. Now, Floyd kept pleading with the officer, saying, quote, "I can't breathe," until he stopped moving and talking about 5 minutes in. Now, Chauvin was arrested on Friday and charged with third-degree murder and second-degree manslaughter and is now in custody in state prison. 3 other officers who stood by and just merely watched the incident without intervening were fired the next day, but have not been arrested or charged yet. And that's what many of these protesters are demanding. Now, another layer in this case was revealed yesterday after it was found that Floyd and Chauvin worked at a nightclub together as recently as last year. So these 2 men actually may have known each other.
That is quite sad to hear, Young. I also understand that media coverage of the public protests has proven to be difficult, to say the least. Could you tell us a bit more about that?
Okay, it's really not difficult to watch the video. You could just search it on YouTube anywhere. Now, looking at the video itself, there's no denying that Derek Chauvin's wrongdoing was apparent. Now, Floyd can be heard literally getting his life just pushed out of him. And about 5 minutes in, he just goes limp and silent. And Chauvin just continues to hold that position for another 3 minutes or so, with the other officers basically ignoring what was going on. And there were also onlookers, people who were filming the video. They were saying, you know, look at him, you got to let him go, but they refused. Right now, there's a lot of focus on the independent autopsy results Floyd's family initiated, which concludes that his death is being ruled a homicide due to asphyxiation from sustained pressure. Now, but the county medical examiner's office also released a report earlier today saying that the cause of death is heart failure and no mention of asphyxiation. The county also said that fentanyl and methamphetamine use were among quote-unquote significant conditions, but his report didn't say how much of either drug was in Floyd's system or how that may have contributed at all. Now, Floyd's family, understandably, is saying that it was a homicide and that intoxication or medications in his system is actually irrelevant.
Young, meanwhile, some claim the public unrest in the U.S. is also a display of the widespread discontent over the disproportionate impact of COVID-19 on African Americans. What are your thoughts on this?
I personally think that it's a combination of factors that were coming in, the confusion from the county as well as at the federal level. I'm not sure if I'd be qualified enough to give you like a credible answer to that, but to be quite honest, I'm not sure any expert would be able to gather enough credible data at this point to answer that question. But the main reason this incident seems to have pushed everyone over the tipping point is, in fact, the continuing number of incidences where Black Americans are killed by police at a disproportionate rate. Now, despite only making up 13% of the U.S. population, African Americans are 2.5 times as likely as white Americans to be killed by the police. And unsurprisingly, the 3 largest states, California, Texas, and Florida, have the highest total number of killings of Black people by police officers. Now, that's the motive behind the protest. Now, it seems that the situation with the COVID-19 lockdowns, the economic impacts, unemployment, the lack of solutions, empty promises, they're also adding fuel to the fire, and people are just basically saying enough is enough. And I think this is all coming down in one big emotion, and basically to set it off was George Floyd. Now, I remember, if you remember the 1992 LA riots, there's a little difference in the actual level of hate. It seems that more like anger is being directed towards law enforcement. There's a lot of frustration, and like I said, it's being directed at law enforcement, local governments, as well as the justice systems. But there's also the opportunists who are ruining it for the people with pure intentions by looting and creating a problem. We've been having cases of looting all over the country. Wherever there's been a protest, there's been looting or looters there to just kind of ruin it for everyone. So it's led to a lot of curfews in major cities across the United States.
Young, going back to COVID-19, how are health authorities there responding to the gatherings of such large-scale gatherings of protesters amid concerns of contagion?
You know, I still hear from people around me, my network, from people that are in my network that have contracted COVID or maybe suspected or may suspect that they have COVID. But from my understanding, the testing process is still a little bit difficult. It's not as easy as people are claiming, or some experts or government officials are claiming. So it's been sort of a mess. Now that's one of the reasons people have gotten so frustrated. Now on Thursday, they all of a sudden announced that they would allow dining in restaurants starting on Friday. So right now, currently in LA County, you can dine in, but none of the restaurant owners are actually opening up the doors yet because there has been no protocols or guidelines in place. So I don't know if LA is ever going to get to the level of observation and effort that Korea has achieved right now. Health experts are now warning a spike. In Southern California, several testing centers have been shut down due to the protests and the pockets of looting and unrest. Now, experts are expecting a spike in the number of infected 2 weeks from now. So to give you an idea where Los Angeles County is at, I believe that the number was somewhere in the 900s yesterday. So 2 weeks from now, we're going to have to see what exactly the consequences of all this is. Testing is not conducted as fervently and stringently around here, which leaves a big question mark on the number of people infected in Southern California after nearly 3 months in shutdown. So that's where we're at.
I see. All right, Young, best of luck to you. And thank you very much for joining us live at this hour with your thoughts.
Thank you.
A leading mobile carrier here is heading a research consortium to better monitor infectious disease outbreaks through IT solutions. KT's initiative has earned an investment from the Bill and Melinda Gates Foundation. And here in the studio, I have the director of the blockchain medical data processor, Mehdi Block, Ko Woo-kyun, whose company is part of that consortium. Welcome to the program.
Good afternoon.
Now, before we delve into the joint project, tell us a bit about your company, Mehdi Block, which I understand was chosen by Forbes magazine in 2018 as one of Korea's top 10 promising startups.
So Mehdi Block is a healthcare IT company that is building an integrated, personalized health information platform that helps individuals to utilize their own health data by actively applying the latest IT technologies such as blockchain. Mehdi Block is creating 3 different products at the moment, and the first one is called Dr. Pilot, which is electronic health record system for healthcare providers. So hospitals can use our solution to create and manage health data information, and by using this solution, they can easily share these info with patients. And the second product is a personal health record system called Mehdi Pass. And people can use this solution to complete their health insurance claim in less than 10 seconds. They can just log into our application and easily download all the documents for a health insurance claim process by clicking just a few buttons. And people don't really need to visit hospitals anymore with this app. And the last thing is called a blockchain platform, Panacea. And this one is providing all the necessary system modules for data and identity authentication, things like for health data exchange. So by combining all these 3 products, we are trying to provide a health data platform in the healthcare industry.
Now, I understand that your company is among a couple of other companies that are seeking to work with KT to promote a platform to prevent pandemics, broadly speaking. What led to your decision to join the consortium?
So the first discussion started in April 2019. At the time, there was an event called Global ICT Workshop hosted by the Right Fund, which is the first non-profit organization established by the Korean government together with the Bill and Melinda Gates Foundation with other corporations as well. So in that event, we were invited to do a presentation about our own project. And when we did our presentation, there was Dr. Dan from Bill and Melinda Gates Foundation, and I believe his title is the Director of Innovative Technology Solutions in Gates Foundation. And he showed a great interest to our project. After the event, because of this presentation, we were somehow connected with KT, and that's how we started to discuss about the project.
I see. And speaking in layman's language, because I'm sure we won't understand the jargon if you use too much of it, but how can blockchain technology be harnessed to deal with pandemics?
Probably lots of people already heard about blockchain, but people don't really understand what it actually does. So let me just explain it simply. What it actually does, it just copies all transaction records, not just in one copy, but in multiple copies at the same time. So by copying all these information in several copies, people can really, it makes almost impossible data forgery or alteration of information in this record system. So by having this functionality, we can maximize the credibility and the transparency of the data. So that's the simple concept of blockchain.
Oh, I see. And this is, of course, including the speed that you talked about earlier.
Right.
What are some of the other merits of blockchain technology in the sharing of medical records then, or medical data?
So like I said, the strengths of the blockchain is that it makes virtually impossible forgery and alteration of data by ensuring that all recorded data is transparently shared with all participants. So utilizing these characteristics of the blockchain, it is possible to easily and efficiently implement the functionalities such as identity and data authentication, dynamic consent system, and reward system necessary for health data exchange. So in this blockchain-based system, individual users can have the right to decide what to do with their own data.
I see. So privacy also.
Right.
Do you believe that the development of better prediction platforms and contact tracing via blockchain technology can help health authorities better track or contain pandemics?
Of course it is. If this study with KT and Gates Foundation is successfully conducted, we can effectively prevent disease transmission by predicting the path of infection. If a person is diagnosed as infected, the secondary infection can be easily blocked by notifying all those who are likely to be exposed, and based on the diagnosed personnel's movement data in a short time. Actually, even at the moment, the government is trying to do these kind of tasks manually, so it takes a lot of time. So it delays the action against the disease transmission.
So basically, it buys you time, it allows you transparency. There's also privacy concerns that is addressed by blockchain technology. What are the future prospects of blockchain technology, in your opinion?
I think through the recent Corona incident, I believe that we have desperately realized how important data is. The study of KT and the Bill and Melinda Gates Foundation is also an attempt to answer the question of how to connect the data from various institutions and individuals to quickly respond to the problematic situation. So in the future, not just health industry, but all the other industries will try to utilize more data, and this trend will accelerate the change in every different fields. Especially in healthcare field, this trend will be like from provider-oriented to a patient-centered trend. So since blockchain is a technology that can significantly increase the data credibility, when the data-driven economy comes, blockchain will be an essential building block of the future technology systems.
I see. All right, all the best to you. Thank you very much for making the time to join us live on our program.
Thank you.
이태원 클럽발 N차 감염이 끝나지 않았고 부천물류센터에서의 감염은 이제 시작이라고 보고 대응하고 있습니다.
An easing of stringent social distancing measures here in Korea has led to a series of sporadic outbreaks, raising alarm over the effectiveness of the newly installed daily life quarantine guidelines. Now, for more on this, I have Dr. Tan Hyun-kyung from Ms. Mehdi Women's Hospital. Welcome back to the show, Dr. Tan.
Thanks for having me.
Now, let's begin with your assessment of the latest outbreaks that range from a logistics center to cram schools and also to venues of worship. The last time you were here, you talked about having one finger on the pulse of the situation, another on the trigger, so to speak, to pull back. Is it time to pull back, Dr. Tan?
Well, I think we understand. The director of the KCDC said it very clearly that the entire country is in a state of heightened alert. And the risk for widespread virus in the community is high. This is a reality that we all understand. We consistently have more than 7% of our cases as unknown epidemiological link, and that indicates that there is some degree of spread in the community. So whenever we have a case and we cannot figure out, how they got infected, that makes us suspect that there is silent spread going on, and that makes everybody nervous. But we have a very robust testing system in place, and I think that's what's our saving grace. That is what's keeping the virus suppressed and allowing us to function in our somewhat mostly open society right now.
Right, like you mentioned, the case in Itaewon, it is fueling a chain of infections. It's led from secondary to tertiary to even septenary, and that's a 7th stage of infection. Are we expecting an 8th or 9th stage of infection, do you think?
I think that we are seeing all these advanced stages of infection just because of how thorough our detection technology is. I'm sure that there are cases of advanced spread in the community. Whether or not we'll be able to detect them remains to be seen. But as the chains of transmission branch out, it just becomes that much more complicated, harder to detect the cases. But it just shows us how quickly and how easily this virus spreads. And now that our society is mostly open, there's more interaction between people, businesses are open, it's going to happen. We're going to see transmission, but we need to get that testing going on so that we can identify those people who are sick and separate them from the healthy.
Do you believe the population density and perhaps the movement patterns of those living in the metropolitan area expose us to greater risk?
Absolutely. So we saw in the Itaewon cluster, the population that was affected, they were young, they were mobile, active, and with the population density, the numbers of people who were visiting the contaminated venues was higher, and so that does affect how easily the virus spreads. If we have communities where people are living far away from each other and the population density is lower, it's much easier to prevent the spread of infection. But here in the metropolitan area, we have one of the highest population densities in the world. And so that's why people are more nervous, and it becomes much more difficult to contain and control the infection.
Dr. Tan, speaking within your capacity as a health expert, what do you suppose is more worrying? The danger posed by chain transmissions or that posed by sources of unknown cases?
I think they are one and the same. They're interconnected because it starts as one case that spreads along a chain of transmission. But as the chains branch out, it becomes harder and harder to find all of those people who are potentially exposed. And that's when you get the cases of unknown spread. The tricky part, the most difficult part about COVID-19 is the asymptomatic spread. That was not the case with SARS. In SARS, people had symptoms, and that's when they started to spread the infection. But with COVID-19, you have young, mobile, active people who do not know that they are carriers, and they are actively spreading it to their family members and people at work. And that's what's making it so challenging to control COVID-19.
Right, I would have to agree. Now, before we delve any further into the situation here in Korea, let's turn our attention, Dr. Tan, to Italy, where authorities are working to contain community transmissions as the country eases its lockdown. For more on the efforts there, I have freelance journalist Nadisha Uyangoda live on the line. Hello, Nadisha.
Hello, good afternoon. Thank you for having me.
Thank you for agreeing to be on the show. Now, Italy has been easing its restrictions in recent days. Has there been a surge in cases amid these efforts?
Well, not a significant one. The number of new coronavirus cases has been dropping since mid-May, and yesterday there were only 178 cases in Italy. So this is the lowest number we've got since the emergency had started, and that may be the reason why on Sunday Dr. Zangrillo, Andrea Zangrillo, the head of San Raffaele Hospital in Milan, suggested that the virus clinically no longer exists in Italy. Of course, some experts, as the Italian health minister, disagree, but we aren't witnessing any second wave of the virus right now.
I see. Nadisha, I hear that Italy has recruited some 60,000 volunteers to serve as civil assistants in enforcing social distancing measures. Tell us more about their role and the public response to them.
Yes, the Civil Protection Agency called for 60,000 civil assistants. They are volunteers, actually, so they won't be paid, and they will be asked to patrol public spaces such as streets, beaches, parks, or even open air markets. They will also be asked to enforce social distancing guidelines. However, the idea of an army of volunteers entitled to tell fellow citizens what they can and cannot do was kind of welcomed with irony and sarcasm by most Italians. We'll see what will happen once they settle in, but yeah, people seem to be very skeptical.
I see. Nadisha, what measures are in place in Italy to respond to a possible resurgence in COVID-19 cases?
We are going back to normality. It's, however, a new kind of normality. We have to keep a social distance of 1 meter, wear gloves on public transport, and we have to have a mask always on. For example, restaurants and other businesses have opened, but with more, strict rules. They have to take fewer appointments. Restaurants have fewer tables and so on.
I see. One final question, Nadisha, very briefly on the subject of measures. Are there any Korean strategies in efforts to contain the spread of the virus that have caught your attention?
Well, in South Korea, you never put in place a lockdown per se. And anyhow, not one as strict as it was in Italy. And Italian media highlighted how you were able to keep the spread under control by tracking those infected. And I think it's the idea behind the Italian government, which led the Italian government to develop and test a new application, which is called Immunia, which will help the government to track the spread of the virus through the country.
I see. All right, Nadisha, thank you very much for joining us at this time with your thoughts.
Thank you.
Now, Dr. Dan back here in the studio, but I might have to interrupt our discussion a little bit because we have the regular afternoon briefing by the government on COVID-19 scheduled for 2:50. But while we wait for them, perhaps I could ask you one question. And then, like I said, I might have to interrupt your response. What are your thoughts on Italy's, that is, recruitment of volunteers to enforce social distancing measures?
That could be a good idea. The Korean CDC has asked for businesses and organizations to designate one person to act as the infectious control monitor for that organization. But for people who are not familiar with the healthcare industry, it might be very difficult to know exactly what to do. So having either volunteers or paid individuals act as trainers or supervisors, points of contact to answer questions for how businesses need to put these measures in place, I think that's a good idea. And I think that's perhaps something that we should consider, is having some on-site training for these monitors so that people can know. I think people are well-meaning. They want to do the right thing, but it can be very difficult to know what to do. And the guidelines are very long, not exactly user-friendly. And so having these individuals help with on-site training, I think it's a good idea.
I also think so too, in the long-term process. Now we have the briefing up next. I'll come back to you later.
본부장 설명이 있겠습니다. Let us now begin our regular briefing for June 2nd, Tuesday, on the COVID-19 response here in South Korea. As of today midnight, we have 38 new cases, and the total number of confirmed cases now stands at 11,541. This includes 1,266 imported cases from overseas. Out of them, 87.4% are South Korean nationals. 24 more people have fully recovered, and a total of 823 are in quarantine. One more fatality was increased, and the death toll stands at 272, with the fatality rate standing at 2.63%. I extend my deepest condolences to the deceased and the members of the bereaved family. We have 38 new cases. 2 of them are imported cases, while 36 are local transmissions. Out of the imported cases from overseas, 1 was from America, 1 was from Kuwait. And next are some details on the local transmissions. First of all, in Gyeonggi-do province at Bucheon City at the Kupang Logistics Center, compared to the day before, we had 5 more confirmed patients, and the total number of confirmed cases stands at 117. 74 are the workers working there, and 43 are the contacts. And in Gyeonggi-do province, patients amount to 54. And at the Happy Nursing Hospital, we also have 1 more confirmed patient, with a total increasing to 6 as of now. Next, in Incheon City, we see the family who were confirmed, and they were also 1 more additional confirmed case, and the total now confirmed stands at 12. And next, there are some of the cases that were related to the religious events or meetings related to the CCC meeting here in Korea at the Gangnam-gu church. There was 1 more person confirmed, and this was the family member of one of the members of the church, with a total now increasing to 9. And regarding a pastor group in Gungpo and Anyang area in Gyeonggi-do province, we have 6 more patients, with a total increasing to 15. And relating to newly planted local churches in Incheon City of Gyeonggi-do province and Gyeonggi-do province, we have additional 22 more people, and the total number stands at 45. And the KSDC, we are witnessing an increase of the cluster infections at the religious groups and the small groups of Bible studies, weekday meetings, and other religious gatherings. And we have seen that the infection is on the rise, so we ask the faith communities to refrain from gathering and switch to non-face-to-face meetings. In particular, we see extended cluster infection in the metropolitan area in Seoul, Gyeonggi-do province, and Incheon. And until the risks of infection subsides, we ask you to meet only on online, so please don't meet face-to-face. And if you are in the group of high-risk groups, including people aged 65 or older, pregnant women, or people with chronic health conditions, you need to be particularly precautious. If having an on-site service is unavoidable, the religious facility hosting the event must reduce the number of participants to ensure that participants can maintain proper distance among each other, check people for fever and other suspected symptoms, ensure hand washing, and require face mask wearing. And providing mass meal or activities that make respiratory droplets travel in air, such as singing or chanting, shall be avoided. And next are some updates on our R&D process. The KCDC is currently carrying out cooperation with the private sector, and we are conducting the antibiotic and plasma treatments. In particular, as for the joint research, we have some of the antibody candidates, and we have confirmed that they were effective in some species of animals as well as laboratory mice. And we are also conducting other animal clinical studies on other species of animals, and the R&D is going on right now. As for the plasma treatment, you can also donate your plasma on on our COVID-19 webpage, and we are currently asking for donations from the patients who have fully recovered from COVID-19. So we ask for your continued cooperation in this aspect. Next, we have some recommendations and words for the public. Starting from mid-May, we have seen a cluster infection from the clubs, and which was centered around young people. And still, right now, we see continued infections and continued chains of transmissions. Moreover, we are also witnessing increased cluster infections, especially with the religious groups, and also the infection is nearing the senior citizens as well as people with chronic illnesses. And we believe that the situation is becoming dangerous as of now. And starting from the clubs and other nightlife entertainment venues, it led to business establishments, including logistics center and call center, and moving on to religious facilities and after-school cram schools. And there are also cases of infection whose sources of infection are unknown. And if this trend continues, we believe that the virus could also lead to attacking the facilities with very high-risk facilities, including nursing hospitals and nursing homes. In particular, the metropolitan area is of grave concern. And in the past, as for the Daegu and Gyeongbuk region, we had a surge of the confirmed 19 patients. And we believe that there were some silent spreaders within this community, and they also spread the virus very fast and very silently in enclosed and crowded spaces, and that also led to exponential surge in the number of confirmed patients. And we shall not repeat the same trend. And this is our determination. And as for the metropolitan area, it is more populated, it is more densely populated. So if this cluster infection does take place again, we believe the damage would be even grave. And we will also put a high burden on the medical system as well. And as time goes on, the COVID-19 outbreak, as for the infection, it takes place at any place and unexpected areas as well. And we also believe that they are also prone at enclosed and crowded, and also in public spaces. So these chains of transmissions will also be around with us for the time being. And as for the metropolitan area, centering around private after-school academies and the religious facilities, we believe that there could also be other cluster groups or populated groups and enclosed spaces that could be prone to the virus. So we ask you to switch to non-face-to-face meetings, and in routine daily lives, please abide by the quarantine protocols, including disinfection, keeping distance, and washing of your hands. So these efforts will help us to curb the further spread of the local transmissions. And please stay started with our efforts in maintaining these protocols. Thank you very much.
Right, that was Kwon Junuk, the Vice Head of KCDC, with the latest on the COVID-19 situation here in Korea. Now, Dr. Dan, he has renewed calls on members of the public to refrain from venturing into crowded and confined places. Places of worship have also been identified as high-risk facilities. What are your thoughts on these words of concern?
Right, places of worship, they have a triple threat. Basically, it's a high-risk environment because they are enclosed. Ventilation may be poor. It's a high-risk population because many are elderly elderly. I think we had one fatality result from a cluster from a place of worship, and then we have one case who is in critical condition because of her involvement in a religious activity. And then there's a high-risk population, high-risk environment, and then the high-risk activity. So people are singing, they're worshiping, praising, and so all of these respiratory droplets are being formed. And so that's why we need to be especially careful with these places of worship. And there is an option of online worship. God knows if you're worshiping online or whether you're worshiping in a church, it's the same, right? And so online worship is probably the safer option right now. And so I think that's why he made that call for people to do that option rather than face-to-face.
Right. Mr. Kwon also spoke about clinical trials using blood plasma therapies. Please tell us a bit about that.
So convalescent plasma has now been, I think, proven to help in COVID-19 cases. And now we have more than 10,000 cases of cured COVID-19 patients. There is a hotline available now for people who are willing to donate their blood to help people survive and get cured from COVID-19. And so this is really good news. I know one of my friends, her son had COVID-19, he was cured, and they were curious to know how they could donate and help be part of the solution for COVID-19. And we have this hotline now for people who are willing to donate blood. And this is good news. It worked for MERS, it worked for Ebola, and so we are hopeful and that it will work for COVID-19 patients as well.
That is good to know. Dr. Tan, the government here, understandably, has strengthened the quarantine measures in place in response to the latest series of infections. How are these latest measures different from the stringent social distancing measures we had earlier on?
Well, they're different because they are more targeted. We now know that the capital region is the hot spot, and so that's where the measures are being concentrated. And then we know now that there are certain hotspot venues as well. And so the social distancing measures are more targeted towards the hagwons and the bars, the clubs, the internet cafes. And so rather than being very diffuse and national, they are being localized and specific.
Right. All right, Dr. Dan, thank you very much for being with us today.
Thank you for having me.
Right, now we end the program on that note. Do tune in tomorrow as we discuss the easing of quarantine restrictions around the world and the fresh challenges brought on amid efforts to restore a sense of normalcy. Now, in the meantime, do reach out to us, that is, through our social media accounts or our homepage, arirang.com. Do take care.